how to get rid of endo belly. So you're struggling with endometriosis and it already sucks already, okay? You've had enough. It's bad enough having endometriosis in itself, but you're feeling bloated, you're feeling distended, and your belly actually sticks out and it makes you look like you're pregnant essentially. And this is affectionately known as endo belly or endo bloat. So endo is actually short for endometriosis, in case you're wondering. So hello everyone, I am so thrilled to be here. My name is Michelle Cooke. I'm a period and hormone naturopath, a natural fertility educator, and a naturopathic emotional release practitioner, sorry. The nerves get the better of you sometimes. And I help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. And I'm the founder and director of Reproductive Wellness. So it's a clinic located in Melbourne, and I see patients both online and face-to-face. And I have been missing in action because I've been working on things behind the scenes. So let me tell you a little bit about that just before we get started. So I've recently changed my focus of my clinic, my clinical practice and social media and my YouTube channel to focus primarily more on periods, hormones, and menstrual cycles. So I actually won't be talking specifically about fertility from this point forward in relation to getting pregnant on my social media accounts and my YouTube channel. But of course you are more than welcome to still follow me because having healthy periods, hormones and menstrual cycles is really key to being fertile as well. But it's just something that I thought that I'd share and mention today moving forward. So very, very exciting. And I am very extremely passionate about educating women on having healthy, easy, pain-free periods and, you know, being able to deal with their menstrual cycles from month to month with ease because it's really, really important and life's short, isn't it? We need to be experiencing a nice, healthy cycle in order for us to enjoy and enjoy life to the fullest. So let's get into it. So as we're going through, if you have any comments, just pop them in the box below. If you're too shy, you can pop it in the comments afterwards if you like. If you're enjoying the content, please hit likes and love so that I know that I'm not just speaking to an empty screen and that you're here with me enjoying it. So let's get started. So endometriosis, let's just quickly cover that. So what is it? So endometriosis is tissue that is similar to the endometrial lining, so it's similar to that. So the lining that sort of is within your uterus, and that particular tissue that looks like that is actually growing elsewhere in the body apart from the uterus, so outside of the uterus itself. And it causes a lot of inflammation. It can also arise in scar tissue and adhesions as well. Most commonly, it can occur on or around the reproductive organs or in the pelvic region. So that's sort of the common location of it. It can be on the ovaries, fallopian tubes, lining of the pelvic cavity, the ligaments around the uterus as well, and on the outside surface of the uterus, generally speaking. However, there are other areas where it can grow as well. So you may find it on the space between your uterus and rectum or bladder. It might be on your bowels, so on your small or large intestines. It could be on your cervix, bladder, rectum, stomach, vagina or vulva. So there are a few different areas, and depending where it's showing up, that might sort of yield what kind of symptoms you may be experiencing as well. So the signs and symptoms of endometriosis, you can have painful periods, heavy periods. The period bleed is actually quite dark in colour, so it's more of that burgundy red. There can be large clots in the bleed as well. There can be painful sex as well, fatigue, diarrhea or constipation, or sometimes both. And there can be pain when you're actually trying to do a poo or doing a wee, especially around that time of your period as well. So endobelly, let's get into it. So what is it? So when you have endometriosis, you can experience endobelly or endobloat. And your belly or abdomen will actually swell. So the duration varies, so it can be a few hours, it could be a few weeks, or even days. So it really depends from person to person. And you feel so bloated, so it can actually look like you're pregnant, which I mentioned earlier, and it can be difficult to even button up your jeans actually. So what causes this endometriosis bloating? So there can be actually a few different reasons why this can take place. So let's discuss them. I'll go through 4 different reasons today. So one is the buildup of endometrial-like tissue. So as we discussed, there's endometrial lesions. So that is the tissue that resembles the tissue that's similar to your endometrial lining that's growing outside the uterus. And this still responds to hormones in the body as if your endometrial lining would as well, or your uterine lining. So it will build up in response to the hormones, so that endometrial tissue, and that it will also shed and bleed each month. So it will do a similar thing to actually your endometrial or uterine lining. So that's pretty amazing, isn't it? It's acting in that same way. But the problem is, normally when your endometrial lining or uterine lining thickens and then it sheds, obviously that blood and all the matter that comes with it has somewhere to go, right? Normally it's got that passage through the vagina to actually come out of the body. But the problem with the endometrial lesions is there's nowhere for that blood to actually be released. So it's actually causing a lot of pain and inflammation as a result of that. So that can lead to the development of scar tissue and adhesions. So these can actually bind organs together and cause a lot of pain and inflammation and irritation that way. And the buildup of lesions will actually arise in inflammation, and that will cause swelling in the abdominal region, okay? And that will lead to bloating, and it will lead to water retention as well. So that's one of the reasons why. So actually due to the endometrial lining, the endometrial tissue itself. The second reason could be endometrial ovarian cysts, okay? So this imposter of the endometrial tissue can actually implant in the ovaries, as I mentioned earlier, and that can arise in cysts filled with blood. And this can arise in, you guessed it, bloating, and that's due to the inflammation and the swelling as a result of that as well. Now the third reason is increased risk of SIBO. So a high percentage of women that have endometriosis actually also have SIBO, which is small intestinal bowel overgrowth. Now this is when there's an overgrowth of bacteria in the small intestine, and normally there's only a small amount of bacteria there, so it shouldn't really have too much diversity there of bacteria. And the exact mechanism of why there's an increased risk of SIBO is still a little bit poorly understood. They're still trying to gather information as to why that actually happens. But one thought is that potentially it's due to endometrial lesions on the bowels. And this can impact the normal function of your bowels, right? Because it's got tissue there that wouldn't normally be there. That's obviously going to impact the normal, healthy function of your bowels. However, if endometrial lesions are present, this will actually slow the motility of your bowels as well. Normally, they have a wave-like movement that sort of moves bacteria along the bowel, and it moves food particles as well, and that needs to be moving nicely. But if there's lesions there, it will slow down that wave-like function and lead to bacterial buildup in the small intestine. So, where was I? Sorry. And if it's slowed down, as I mentioned, that will lead to a buildup of not so desirable bacteria in the small intestine. It shouldn't be there, okay? And the symptoms can include bloating, constipation, diarrhea, and there's a few other symptoms as well in relation to SIBO, but they're kind of the main ones. And but the thing is to consider, so in relation to that increased risk of SIBO, not all women that have SIBO have endometrial lesions on the bowel. So, another reason why they might be presenting with SIBO or the increased risk could be that there's actually, it's due to inflammation there. The pain receptors and mast cells are actually activated, and that leads to leaky gut syndrome. So that's when there's a lot of inflammation and damage to your intestinal lining, and things are actually passing through from the small intestine to your bloodstream that shouldn't be there, overwhelming the immune system, etc. And alongside that, there's also gut dysbiosis as well, which basically means an imbalance of the good and bad bacteria in the gut. So that's another reason why you may present with SIBO as well, considering that there's an overgrowth of bacteria in the small intestine. So it's all to do with that, okay? Potentially. They're still not quite sure, remember? Now, the fourth reason could be an increased risk of IBS. So there can be an increased incidence of irritable bowel syndrome or IBS in women with endometriosis, and it's quite a crazy high amount. So same with SIBO as well. I can't remember what it said in the research exactly offhand, but I think SIBO was maybe an 80% risk, and IBS was kind of similar, sort of 85 to 90%. So quite a lot of risk there. So again, this may be due to the endometrial lesions that I mentioned that are on the bowels that are impacting that intestinal function, and that leads to inflammation, which or it could be due to the inflammation, which, remember, if you've got inflammation in the body systemically, it can also cause inflammation in the intestines as well, leading to leaky gut and leading to an imbalance between the good bacteria, the bad bacteria, and a build-up of an overgrowth of bacteria in the small intestine, okay? So that could be the two different reasons, as I mentioned earlier with the SIBO potentially. And symptoms are quite similar to that of IBS as well. So IBS and endometriosis kind of have a little bit of an overlap in terms of the gastrointestinal symptoms. So, you still have things like bloating, there could be constipation, there could be diarrhea, there can be gas, there can be pain, there can be cramping, all those kind of things. It can be quite confusing, and sometimes people get misdiagnosed with IBS when in fact it was endometriosis. But you can in fact actually have the both of them coexisting together, so that is a possibility as well. So how do you get rid of endometrial bloating? So treatment of this is all dependent upon why you actually have the endo bloat or endo belly, okay? So out of the reasons that I mentioned earlier, so, is it related to SIBO? Is it IBS? Is it, as a consequence of the endometrial lesions generally? Is there ovarian cysts there? So you need to look at those things and sort of address why you actually have it as to how you're going to actually help with the endo belly. And in my experience, you simply can't ignore the digestive system and the contributing role that it has in terms of endometriosis, and the role it has to play in driving endometriosis, the growth, the proliferation, the painful periods, everything. You need to look at the gut and the awful symptoms that accompany it. You always have to go back and look at the gut, that's for sure. If you just focus on treating the reproductive symptoms of endometriosis, so the heavy bleeding, the painful periods, the clots, the hormone imbalance, you won't get far. And I'm just being completely honest. And similarly, if your only treatment strategy is actually getting a laparoscopy and using excision surgery to remove those endometrial lesions, and that's the only thing that you do, you also won't get far with that either, because you're not addressing the root cause of that endometriosis. It's very, very important to get to the bottom of it. It's very complex. There's many, many different aspects towards endometriosis and why you present with that, so that needs to be addressed. And every patient that I've seen with endometriosis so far has some degree of gut dysbiosis or issues there that are contributing to the endometriosis itself. So whether it be SIBO, whether it be IBS, maybe there's a bacterial imbalance in the large bowel, in the small intestine, or maybe it's in both, and that's a total possibility as well. It's important to look at both the small and large intestine together. So how would I know that my gut is actually contributing to endo belly? So testing gut function is so important to assess this, and in my clinical practice I usually refer women with endometriosis for gut health investigations. So one of the tests is known as a methane/hydrogen breath test for SIBO, which measures the amount of those gases, and if they're over a certain level, that will indicate that there's SIBO there, or small intestinal bowel overgrowth. And this is an assessment of the small intestine only, so it doesn't give us an idea of what's actually happening in the large bowel or large intestine. So the other test that I do looks at the microbiome. So this looks at good and bad bacteria. It looks at different sort of enzymes and things that are produced in the gut, so you can assess sort of gut function and what's happening there. And it's assessing what's present in the large bowel. So this is essentially a poo sample that you sent off, and that's getting analysed that way. So these tests, the tests that I discussed, so the microbiome test and the SIBO test, they're functional tests that are commonly done by a naturopath, and they can actually refer you for those. So my suggestion would be, if not already, make sure that you have a naturopath as part of your team. So you may already have a gynecologist, perhaps your GP's on board, but you definitely have to have a naturopath on board as well to actually address the root cause of your endometriosis as well. And particularly one that specializes in periods and hormones, like myself, to assess your digestive function and whether that's actually contributing to endometriosis and all the other things that contribute to it as well. It's not just a reproductive system disorder. There is a lot more factors to it than that. And the difference in quality of life that you can make from assessing the gut and treating the gut in terms of endometriosis is truly quite remarkable. It's really amazing the difference that you can make to someone's life by working on those factors. And I use a combination of herbal medicine, nutritional medicine, diet and lifestyle advice. I also use a technique known as NER, or Naturopathic Emotional Release, to assess if there's any underlying emotions in relation to the endometriosis that presents, which is extremely, extremely important. And then basically the treatment is based on what my findings are from those gut function tests. So depending on what they yield, that will give you sort of individualized support on what needs to be worked on. So if you are experiencing endo bloat or endo belly, or you're really having a tough time with your endometriosis, I would absolutely love to help you. So I invite you to book a free 15-minute discovery call where we can find out a little bit more about what's happening for you, whether we're a good fit, what would be involved with us working together. So that's sort of a good opportunity to do that. So if you're watching on Instagram, there's a link in my bio. If you're watching on Facebook or YouTube, I'll pop a link down below for you for that. I would absolutely love to help you. It brings me so much joy to help people with endometriosis because it's so debilitating and it affects so many aspects of your life, your social life, work life, you name it. And it brings me so much joy to actually change that person's life so that they can live it to the fullest. So remember, a thing to remember is that all the lives that I've done on Instagram and Facebook are actually on my website, on my blog. So I have the video there and I have the written explanation underneath. So if you head to reproductivewellness.com.au/blog, they're all there. So you can look up past ones that I've done as well if you've missed any. So yeah, make sure that you check out that. And do we have any questions before I finish up today? I'm just going to check Facebook as well. Just give me a second. Okay, so no questions so far. But if you think of any or you're too shy to mention it now, you can always mention it later or send me a PM or DM and I'd be more than happy to actually answer those for you. I would like to thank you so much for watching, and I really appreciate you, and I really appreciate that you're here and that you're listening. And if you're watching on my YouTube channel, be sure to like or subscribe. And just remember, I will be here live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about something period, hormone, or menstrual cycle related. So I really, really look forward to seeing you next Wednesday. Take care and have a lovely evening. Bye for now.